Hello and welcome to today's webinar, The Value of ZWave in a Cosmetic Surgery Practice. This webinar is presented by Zimmer Aesthetic Division. I'm Regina West and I'll be moderating the webinar today. I hope that everyone is managing to get through this COVID-19 pandemic okay. During today's presentation, you may submit questions by typing them in the Questions tab on your webinar control panel. Following today's presentation, we'll cover those questions live, and if there's not enough time remaining for all of the questions, answers to your questions will be emailed to you. Okay. In a moment, I'm going to introduce the speakers for today's webinar. But first, I'd like to tell you a little bit about them. We have Dr. Stephen Bengelsdorf and esthetician Carmen Primrose standing by. And you can view more details about them on the bio screen I'm showing right now. I'll just summarize a little bit about them now as I introduce them. Now let's bring them on camera. Carmen, Dr. Bengelsdorf, can you turn your cameras and your microphones on, please? Here we go. There's Dr. Stephen Bengelsdorf.
Hello.
And Carmen Primrose. Hi. How are you today?
Very well, thank you.
Okay,
Hi.
so hi, Carmen. Dr. Bengelsdorf, first, I'll introduce you. He's a board-certified surgeon and founder of Franklin Skin and Laser in Franklin, Tennessee. He's been practicing cosmetic surgery and aesthetic dermatology for over 15 years. Even though Dr. Bengelsdorf is a fully trained surgeon, over the course of his career, he's also made an extensive use of non-invasive technologies like energy-based devices, injectables, and topical agents. Franklin Skin and Laser is a top cool sculpting, cool tone practice in the Midwest territory. They offer ZWave treatments with every cool sculpting procedure at an additional charge, and they say that their patients always opt for maximizing their results by adding ZWave. During this webinar, Dr. Bengelsdorf will talk about what ZWave has done for the patient experience and how this technology is added to his practice's bottom line. He'll also answer your questions after his presentation. So thanks again for joining us, Dr. Bengelsdorf.
You're welcome.
Okay, and next we have Carmen Primrose. Hi, Carmen.
Hi, Regina.
Carmen is the lead esthetician at Dr. Bengelsdorf's practice. She works hands-on on a daily basis, performing treatments with energy-based devices, and she's an expert with the ZWave radial pulse technology. Zimmer USA's Z News has also featured a couple of videos by Carmen talking about Zimmer ZWave and Z Cryo devices. She'll speak on her clinical experience and will also be available for Q&A, providing insight on ZWave protocol, settings, patient feedback, and much more. Okay, so again, thanks to both of you for joining us today to speak, and for any attendees just now joining us, I've just introduced our two panelists for today, Dr. Stephen Bengelsdorf and Carmen Primrose. And I'd like to welcome everyone again who's just joining us to the webinar, The Value of ZWave in a Cosmetic Surgery Practice. Now, Carmen and I will be turning our cameras and microphones off so that I can hand over the presentation to Dr. Bengelsdorf. So give me just a moment, and Dr. Bengelsdorf, we should be able to see your screen.
Okay, so today we're going to talk about the Zimmer ZWave. It's a self-contained extracorporeal shockwave device, has a very small footprint and a very sexy aesthetic. So it's made by a German company that's been around for over 50 years with 2 offices in the United States. They're very easy to get in touch with. So what exactly is extracorporeal shockwave therapy? Well, it's the application of mechanically generated external sound waves. It's been used for lithotripsy and physical therapy for many, many years. It's often used to clear edema fluid from damaged tissues and improving lymphatic drainage. It also helps with pain and increasing blood flow. It's been shown with repeated use to stimulate collagenesis and angiogenesis as well. And it's most commonly used immediately following non-invasive lipolysis procedures such as CoolSculpt, UltraShape, things like that. So this is a cutaway of the device. The gray cylinder in the center is the ferromagnetic projectile. So when it is loaded at the top, it's in the middle right now, the polarity of the magnets is reversed electrically along the side of the tube holding the projectile. Zimmer has coined the term soft shot technology. What exactly is that? So Zimmer utilizes electromagnetic instead of pneumatic energy to propel the projectile within the handpiece. Why is this important? It's more reliable, it's more comfortable, it's easier to use and to maintain. So this is Newton's second law of motion, and very simply, force equals mass times acceleration. And this is a comparison of the two projectiles. So most shockwave devices use a projectile to generate sound waves. The object on the left is a typical pneumatically driven projectile, weighs about 1/10 of a gram. The object on the right is Zimmer's projectile, which weighs about 6 times as much, 0.6 grams. So if you're the patient, a device with pneumatic technology has a projectile that's over 5 times lighter. It has to strike 5 times faster than the Zimmer system, which has a heavier projectile. This is actually not good for the skin and the patient. It makes the patient's skin uncomfortable. And in fact, in some devices, a topical anesthetic is needed, but not with the Zimmer. So a good analogy would be if you had a small hammer versus a large one. So the sledgehammer on the right is almost 6 times heavier than the hammer on the left. A large hammer at a slow acceleration generates the same amount of force as a small hammer with a faster acceleration. The force is the same, but the faster moving object appears to cause more pain at the device-patient interface. So the way the ZWave works is it transmits pressure waves through the skin. They spread radially. This is a little cartoon demonstrating it. And this is the handpiece. And the pressure waves are transmitted to the tissue. They penetrate as deep as 3.5 or 4 centimeters. So why or how does it work exactly for cellulite? So it stimulates a wound response that increases blood flow to the area, which brings in platelets, growth factors, other cytokines. It's been shown to cause angiogenesis when treatments in series are done. The sound waves are actually working to advance lymphatic drainage, which decreases fluid edema. It's also shown to increase metabolic activity and collagenesis. These are all good things. So the illustration on the left is an example of normal, smooth, healthy skin. The one on the right shows the pathophysiology of cellulite. So you have enlarged fat cells bulging between septae, causing irregularities. You can see there are sort of hills and valleys on the surface of the skin. And it's because of the anchor points of the connective tissue between the skin and scarpous fascia. So cellulite is really a combination of conditions. It's the enlarged fat cells, poor circulation, fibrosis of those bands connecting tissue, and water retention. So now that I've reviewed the basic anatomy and physiology, I'd like to give you some clinical examples. Back in the day before social media, we had different kinds of influencers. We used published literature, physician testimonials, what our colleagues would tell us, and then finally before and after pictures. So I'm going to be the first one to tell you, take all of these with a grain of salt. And this is from a study done some time ago in Spain. It shows thermography to demonstrate the surface temperature of a patient's skin. So on the top slide, taken before the first ZWave treatment, you can show surface temperatures are below normal because of poor blood flow. The bottom slide, taken a few weeks after the 10th treatment, shows a rise in surface temperature, suggesting that there's improved blood flow or angiogenesis. So this is the same patient, same study, high-resolution ultrasound. The top slide shows an ultrasound image that shows large white fat cells. There's darkness between the cells indicating trapped fluid, and then thin lines of horizontal connective tissue and an irregular surface. The bottom slide looks a lot better. Several weeks after the 10th treatment, you can see smaller fat cells, less fluid, thickening of connective tissue, and a smoother skin surface. So I actually did a Medline PubMed search and was looking for as many articles as I could find on cellulite and shockwave therapy. This is one that shows both ultrasound and histopathology, that it causes neocollagenesis as well as neoelastogenesis. This one looked at histology and immunohistochemistry, which also showed more collagen, improved microvascular density, increasing of the skin thickness, as well as upregulation of fibroblastic growth factor number 2. This again was high resolution ultrasound that showed collagen remodeling and improvement in the skin. Okay, so I just showed you 4 studies that's demonstrated the benefits of extracorporeal shockwave therapy. And they all pretty much come to the same conclusion, that for non-focused shockwave therapy, you have increase in the skin thickness, improvement in microcirculation, and formation of new collagen and elastin. And that's not too hard to believe. This study is actually a meta-analysis of 11 clinical trials, and it simply shows that both focused and radial shockwave therapy improve cellulite. So there's a good amount of evidence in the published literature demonstrating this. And then finally, although I've been speaking mostly about cellulite, ZWave works great as an adjunct to lipolysis. This is really where ZWave shines. We do a lot of cool sculpting, and I can't imagine doing it without a ZWave. In fact, it's my understanding that all non-invasive fat-reducing technologies have shown to benefit by addition of shockwave therapy, resulting either in better results, quicker, easier recovery, or more consistent outcome. So what are other physicians saying about ZWave? Zimmer has lots of testimonials. I just picked a few of physicians who I know and respect. Dr. Shambin, we have found that results are improved and recovery is quicker and more comfortable. Yep, I would absolutely agree from personal experience. Dr. Taub, superior to hand massage, absolutely. Not had any patients complain of postoperative pain since starting this method, absolutely. Also before ZWave, every now and then I'd have to write a script for some Percocet or analgesics because the patient was having some pain. And since we started using ZWave, I have not. There is a huge amount of variability when you do hand massage, and I think that's part of the problem. With ZWave, it's very, very consistent. Dr. Golden, much less painful than kneading, agree completely. It's painful not only for the patient, but for the person who's doing the kneading. It's a really cold block of tissue. More reproducible improvement, fewer post-procedure complaints or adverse effects. Again, I agree completely with those statements. So in summary, ZWave improves short-term increase of blood flow because of the massage and the vasodilatation. Long-term, it improves blood flow by stimulating angiogenesis. It causes new collagen and elastin to form. The sound waves improve the lymphatic drainage. And it can be used in multiple applications, not just aesthetics and plastic surgery, but men's health, tattoo removal, and it seems like every day there's another use for it. It's a Class 1 device, so you can delegate it. A medical license is not required to operate it, and there are no disposables. Okay, so now let's look at some before and after photos. So about pictures, usually I automatically discount most pictures that I see because the before and afters are too inconsistent. What do I mean by that? Well, usually there's a different background, there's different lighting, there's different color balance, there's a different camera, and different distance to the subject. And you really can't use any of those pictures, in my opinion, because it's just too easy to show big differences with changes in the angle or the lighting. And then in many of the pictures that I see, they're technically as perfectly as can be. They may be done actually in a studio where everything is consistent. I sometimes have trouble seeing a difference. What I like to say is that if it takes me more than 5 seconds for me to see a difference, there's not much of a change. Now, having said all that, with that in mind, cellulite and acne scarring, to me, are the 2 most difficult clinical conditions to photograph. Very, very difficult, very, very hard to see on the before and afters. You're trying to show a three-dimensional object using a two-dimensional image that was taken with a single lens. And the truth is, with both of these conditions, oftentimes we see better results in person, as well as the patient sees better results than what I can demonstrate in photography. Having said that, here are some pictures of my patients. I apologize that the color of the underwear is different. This is a female, and you can see the front of her thighs. You can see that there's just much more undulation. I don't know how well it's showing up on your screen. Clearly, she still has some cellulite and rippling on the after picture, but it's a lot better than on the before. Also, again, you can see improvement in the cellulite. Now, there are absolutely some areas that are not improved, which to me is good because it shows that I didn't change the lighting. So if you look at the middle of the right thigh laterally, you can see there's a little divot there that's still there on the post, but that's okay because you can see how much improvement there is in the left posterior thigh. Similarly, this is another female patient. It's a posterolateral view of the right thigh. And again, you can see that little divot right in the middle, and you can see how much improvement there is from everything on top of that. This is an example of cool sculpting, 2 treatments, flanks, lower abdomen. This patient was really happy. And this is an example of 2 treatments to a man, his lower abdomen, and I think this is about as consistent an image as I can get you, and I think you can pretty easily see the difference. So in conclusion, this is my conclusion. It's solely based on my opinion, which is based on my actual use of the device and my patients. You need it, buy it. If you do any type of body contouring or cellulite treatment, it's really a tool you should have. Honestly, we bought one, and 6 months later, we bought a second. Patients love it. They're buying the treatments. They're very happy with the results. I haven't been asked for money back, and that's it. And thank you for your attention.
Okay, thank you, Dr. Bengelsdorf, for that presentation. I will now take control back of the webinar, and I will ask Carmen to share your mic and your camera, please. Okay, before we get to the Q&A, hi Carmen, hello again. I would like to invite you to share some comments about your clinical experience with ZWave and some feedback from patients.
Yeah, absolutely. So ZWave really plays an important role in all of our body shaping treatments. Not only do we use ZWave as a standalone treatment for the reduction and smoothing of cellulite, but it's also a key adjunct. And as Dr. Bengelsdorf just mentioned in his presentation, ZWave in tandem with cool sculpting has really been a game changer for us. The same can also be said for our radio frequency body treatments as well. From the provider side, of course, we love the efficiency and the continuity that ZWave gives us. But I think the most exciting part is that patients truly see a difference, not only in the recovery and in the post-care process, but in their overall treatment outcomes as well. Across the board, patients tolerate the treatment very well. Many even actually enjoy it. I've had patients tell me that it compares to a deep massage. They report less swelling and soreness post-treatment, less lumpy, knotty texture, and they also generally see noticeable results much more quickly. So this really applies to whether they're having treatments to reduce fat or tighten the skin, and sometimes, honestly, a combination of both. This patient feedback is in comparison to when we were performing these same body shaping treatments only prior to using the ZWave in combination.
Okay, thank you so much for those comments, Carmen. Now, let's go to Q&A. Okay, so let's look. Some questions are already starting to roll in. Before I start here, if there are any attendees who haven't yet submitted questions, please, I encourage you to do so now or at any point during the Q&A. The first question is, Do you use ZWave as a standalone for cellulite, or do you combine it with other technologies to treat cellulite?
Both. We sometimes use it just as standalone. Sometimes we'll use it with radio frequency. What do you think, Carmen?
Yeah, absolutely. It depends on the patient and I think the severity of the cellulite and what's going to work best for them.
Okay, next question. What are all of the therapies that you offer for non-invasive body sculpting, and why did you choose them?
Oh, wow.
All of them.
All of them. Well, I'm a surgeon. I started out doing liposuction and tummy tucks. And as time went on, I was just more and more impressed with the non-invasive or minimally invasive devices on the market. We had an Exelis device prior to Cool Sculpting that worked well. Cool Sculpting seems to be working a little bit better. I would say we probably have one of everything at this point. Would you agree with that, Carmen? We do cryolipolysis, we do mesotherapy, we do radio frequency, we do some electromagnetic stuff. So honestly, we do a little bit of everything. Why? Because they work, but you have to match the right technology with the patient.
Okay, let's move on to the next question. What differences besides efficacy do you notice when treating post-cool sculpting? Any differences in side effects like prolonged numbness, bruising, and soreness?
I think I'm going to let Carmen answer that.
I would say that there's actually a decrease in those side effects when you use ZWave afterwards versus the old traditional hand massage. That in particular, patients had much more swelling post-treatment and a lot more of that late onset pain. As Dr. B mentioned, he would have to write scripts every now and then. Patients would call back that night, the next day. It just doesn't happen anymore now that we use ZWave.
Yeah, when you're doing hand massage, you actually are compressing the skin as well, so you're probably damaging it a little bit. I think that when you're using ZWave, the shock wave goes really through the skin and to the fat, so it's doing more damage on the fat than your fingers on the skin.
Yeah.
Impressive. Okay, we've got another question here. What is the treatment? This may be for you, Carmen. What is the treatment protocol for cellulite? How many treatments? For how long? How many days between treatments?
So again, depending on the severity, we typically do a 10-session package, and you'll do 2 sessions per week for 5 weeks. Then just go into more of a maintenance mode after their initial package. And that, again, varies on the patient's individual grade of cellulite.
Okay, very good. Now, speaking of your packages, how much, another question, this is a lead in here, how much do you charge as a standalone compared to a combination with another device?
Okay, good question.
I can actually answer that because I know that off the top of my head. So we actually give the patients, when we're doing, let's say, cool sculpting for them, we tell them we can do hand massage mechanically, or we can use ZWave, and I'm pretty sure we tell them it's about $100 for an upcharge, and we've not had anybody not take that.
Right.
And the standalone cellulite treatment typically goes for around $1,500 and up, depending on how much of the leg needs to be treated for a 10-session package.
And you can treat other areas of the body besides the leg for cellulite, correct?
Of course, of course.
Okay. All right, let's go to the next question. This is also for you, Carmen. Do you prefer administering cool sculpting with ZWave after or over hand massage? And how about your patients? Do they prefer?
Yes, I prefer it and my patients prefer it. As Dr. B mentioned in his presentation, it's a lot less stress and trauma on the provider because you're not having to squeeze and knead that really cold tissue. And I feel like you're able to give a much more thorough massage to the patient and really break up that frozen fat. And of course, the patients tolerate it much better than when we used to do the hand massage.
So have you gotten comments from your patients, anyone who has experienced the treatment cool sculpting without ZWave after versus hand massage?
Yes, we have. And patients, every single time, I don't think we've had anyone say that they don't prefer the ZWave. Most people say it's night and day difference on the level of discomfort.
Wow, night and day. That's pretty dramatic there. That's great. Okay. Next question. Were there any good surprises from using ZWave, like any applications or experiences you didn't anticipate? Either of you?
I think ZWave is really like a hammer, and you just find different uses for it. I can tell you that when my wife had some sore muscles, she went into the office and we did ZWave on her, and that was helpful. I can tell you that we're using it now with tattoo removal. So it has multiple applications. Some applications I'm not that interested in doing, such as the men's health applications, but it certainly has many different applications.
Okay. Next question. How frequently do you use the ZWave in your practice?
It's every day. I don't think there's a day that goes by where it's not used.
We have two machines, and oftentimes they'll both be in use.
Wow. That's a whole lot of ZWave.
It is.
But you have a very large practice, correct? One of the largest.
I guess it's all relative.
One of the largest providers for cool sculpting in, what was it, the Midwest region?
Yes.
Cool sculpting, cool tone. Okay, so next question. I'm not sure if we've sort of covered this already. Let's see if we can elaborate for this person. How do ZWave treatments alone or ZWave in combination with other treatments compare with other technologies you may have used for cellulite?
Okay. So the easiest, I tend to be very honest, blunt, straightforward with the patients. And for a long time, when patients would come to me with cellulite, I would tell them, I'm sorry, nothing works. And just flat out. And absolutely nothing worked. The first thing that I think really worked was probably the VelaShape device. So some combination of vibration, massage, ultrasound, they did some heat, and you actually saw some nice pictures with that. But it was so labor intensive that I didn't think it was worthwhile to add it to my practice. ZWave, it's just one of those things that you take a leap of faith, you use it, and then everybody's happy with it. And it is just much, much easier to use technically than any of the other devices that I am familiar with for cellulite.
Is it easy for you to train your staff to use ZWave?
Probably the easiest machine I have.
Oh, okay, that's great. So I'd like to encourage the attendees to continue to submit these questions. These are great questions, and it's not too late. If you have a question, send it right in on the questions tab on your webinar control panel. Okay, moving on to the next question. How does, Carmen, you sort of touched on this. You said you got a lot of love about the ZWave, but specifically, how does the ZWave treatment feel for a patient?
Well, post cool sculpting, patients are numb, so they don't feel a whole lot on the surface of the skin. For the standalone cellulite treatments, most patients really enjoy it. The last woman that I treated just a couple days ago was saying how it felt like a deep massage and that she was looking forward to her appointments every single time because she just felt so good afterwards.
Okay, we kind of, again, we got into, there's another question here. We kind of got into it a little bit previously, but maybe we can give a little bit more of an elaboration. The question is, can you list surgical and non-invasive procedures that you've used with ZWave, and did it significantly affect your results with all?
Well, I can say that when I got the ZWave, I was already doing mostly non-invasive treatment. I had been doing tummy tucks and liposuction, and certainly if I had had any irregularities, I would have, and I had ZWave, I would have used it. I tend to be very cautious, so I did pretty well, but I'm personally familiar with numbers of plastic surgeons who've used it both with tummy tucks and with liposuction. I'm sorry, what was the rest of the question?
Did ZWave have a significant effect with all of the surgical and non-invasive treatments that you've tried it with?
Yeah, I think so. I mean, that I've tried it with. Again, I haven't personally used it with tummy tucks and lipo, but it certainly seems to be a very useful adjunct for any of the other energy-based devices that we use.
Okay, wonderful. It looks like we are running out of time here. We promised a 40-minute webinar, and we're running out of time for Q&A now. So I'd like to thank you both again so very much for your presentations and for your comments in the Q&A. It was a very nice presentation. Thank you again.
You're welcome. Thank you, Gina.
And if anyone would like more information about ZWave and ZWave Pro, please visit Zimmer Medizin Systems website at www.zimmerusa.com. You may also visit shop.zimmerusa.com to purchase accessories and marketing materials for your ZWave device. You can also check out this webinar and many other informative ZWave webinars from the past on Zimmer USA's YouTube channel or on our aesthetic website. In the ZWave section, there is a big array of past webinars to browse through for even more information. And this concludes today's webinar. Thank you very much for attending. A recorded version of this webinar will be emailed to all attendees so that you may review any of this information at your leisure. Have a good night.